Okay, well, today I'm going to talk a little bit about EKG readings and how it's affected by hypoxia in or the building up of the endocardium and all the way up to the buildup of blood in the epicardium. And this causes different readings in our EKG that could tell us about different kinds of diseases that we might have or different problems. And first, I'd like to talk a little bit about the normal EKG reading here that we can see. And this normal EKG reading has a couple different parts to it. So here we have a P wave, a Q wave, an R wave, an S wave, and a T wave. And so even in between all of these different waves, we have a couple different parts in it. And the main part that we're probably going to talk about a lot is known as the ST segment. And it is from this part to this part. This is the ST segment. Other significant parts are this part right here is called the QRS complex. This is called the PQ or the PR gap or segment, and this is known as the QT interval. And I think we have one more. We have the PR interval right here. So throughout these sections, what is affected most by hypoxia is something known as the ST segment. So the first one of these problems looks like as you can see, NST is how it starts. So it's known as the non-ST elevation mitochondrial infraction. And so it talks about what happens to this ST segment right here, and that is normally what is affected when it comes to hypoxia. So when we talk about non-STEMI, if you look at let's say this is the bottom part of the heart, and here you have the sternum, and then here you have the endocardium, and here you have the epicardium, the mitocardium, and so here the endocardium can sometimes bulge out because it gets a bunch of things in there. This will cause non-STEMI or a non-STEMI reading to occur, and this causes depression of the ST segment right here, but it also causes the EKG to kind of look like this. So because it affects specifically the ST part, the first bit will not be affected as much, but there will be a big difference here in the S section and in the T section of this EKG reading. Here we have the S and the T. So as we can see, even though the S already goes lower than your Q normally, this time it goes all the way down to the baseline of our EKG reading, since during this part of the repolarization, or I guess not the repolarization, but the S is when this part here gets depolarized, the superior left ventricle, and since we have this here in the way, it's going to cause the S to go down, and then the T to also not be as big as it typically is when it starts repolarizing. But this is non-STEMI. I guess we should also talk about one of his other family members called STEMI. As you can see, spelled the same, and it also affects ST. And this here is known as ST elevation, which is very different from this depression. So you have your baseline here. but instead of starting at a higher elevation here, you start at a lower, and then you have your P and Q like normal, and then you have your R, but you just don't go all the way. You just can't go down. You see this S and T area are very elevated. And that's because of what is occurring here. And if we were to look back on something like this, that is because here in the left superior ventricle, we don't just have the hypoxia in the endocardium, but we have it all the way, kind of looking like that, all the way from the endocardium all the way to the epicardium, and this causes the EKG readings when you're going to attempt to depolarize the S section or the left superior ventricle. Makes them kind of like bounce off to the sides, since this is already negative, and so this causes it to go from a negative to negative reading, or a negative to positive reading, which makes it not be able to depress as much as normal, and it makes the T wave just kind of not as much because it's not able to do its job properly. So here we go. Here we are. STEMI and non-STEMI.
What causes hypoxia?
Hypoxia is caused when the cell, so the different parts of our heart here, the bottom part, so past the bundle of His, we have the AV node feeds down into here, into the sternum and into the Purkinje bundles, and they kind of go out all over this whole area. And sometimes when the blood is wanting to be sent, sometimes we'll have this area a little bit too filled because the endocardium kind of swells as it gets filled.
The hypoxia means the lack of oxygen supply from the blood.
The oxygen doesn't have, so mitochondria isn't able to be active because of the lack of oxygen, and this causes this endocardium to kind of like expand or block this area.
Lack of ATP.
Yeah.
Yeah.
So we're not going to have ATP coming in and here, so this hypoxia is going to occur. Since mitochondria isn't able to make ATP because we lack oxygen.